Good afternoon and welcome to Tacoma's Elder Care channel. My name is Bob Michaels and I'm the host of your channel. I'm also an estate planning and elder law lawyer here in Tacoma with the law firm of Smith Alling. We're both here for fun and pleasure, but we also want to share with you some real important topics today. We have Bob Leroy from the Alzheimer's Association of Washington State. He's the executive director. And we're going to talk a little bit in this segment about the federal and Washington public policy that's taking place. There are some changes, as we understand, with regards to the Washington state plan. So without further ado, Bob, would you introduce yourself?
Thanks, Bob.
We'll jump in there.
I'm Bob Leroy. I'm the executive director of the Alzheimer's Association Washington State Chapter. We serve individuals and families across Washington and also northern Idaho. And I am pleased to have an opportunity to offer an update on what's going on both at the federal and also state level in respect to public policy. At the federal level, the real issue is how can we divert more federal dollars specifically to Alzheimer's research. It's an area of chronic disease research that is really significantly underfunded, and we're very excited about some growing momentum in Congress and elsewhere in the other Washington to drive more money to Alzheimer's research. The reality of it is Alzheimer's disease is the most expensive disease in America, and this year, for every $26,500 the federal government will spend on Alzheimer's care, primarily through Medicare and Medicaid reimbursement, it will invest less than $100 in Alzheimer's research. So this notion of driving more money from the federal government through the National Institutes of Health to fund Alzheimer's research is terribly, terribly important. And we have some very exciting news. Just last week, the Labor and Health and Human Services Subcommittee of the House Appropriations Committee designated $300 million in additional Alzheimer's research funding in their version of the upcoming federal budget. So we're very pleased that we've got that level of support, at least from one of the subcommittees, and we're urging everyone to reach out to their members of Congress and get them to support this addition of another $300 million in funding for Alzheimer's research. At the state level, we are moving diligently as part of a very large and diverse group of stakeholders to develop the very first Alzheimer's disease plan for Washington State. We had actually become one of only 6 states in the country that hadn't even started work on a plan. We're catching up quickly, and we have wonderful support both from the governor's office, both houses of the legislature, the major administrative entities, the Department of Social and Health Services, the Health Care Authority, the Department of Health. We have folks in our working group that are living with Alzheimer's, that are caring for loved ones with the disease. And our goal is, by January of next year, to be able to present to the legislature a comprehensive plan for helping individuals and families in Washington State deal with what we believe is nothing less than a public health epidemic. Supports that are needed with some strategies and recommendations as to how to implement some of those programs, particularly those that are really within the purview of state government. So it's a very exciting breakthrough really for us, calling attention to what's really happening for folks in this state with Alzheimer's and developing a comprehensive plan to really collaboratively do a better job of reaching and serving individuals and families.
Wow, that is impressive, particularly in today's age of gridlock, if you will, and short dollars. But as you mentioned, Alzheimer's, both on a national level and right here in Pierce County, Washington, the numbers are growing exponentially.
Yeah, well, it's the 3rd leading cause of death in our state. And of the top 10 causes of death, it's the only one for which there is no cure, there is no means to prevent.
Great. Well, Bob, why don't you again give a number and some contact information, and then we'll encourage people to not only contact your office, but also to contact their legislators and
Sure.
see if we can bring about some important change.
The best way to reach us, the gateway to all of our services and supports, as well as additional information about our advocacy and public policy work, are our helpline. It's toll-free. It's professionally staffed 24/7. The number is 1-800-272-3900. 1-800-272-3900. Our website, alzwa.org. alzwa.org.
Well, thank you very much, Bob, and we hope to have you back again, and anything we can do to help, we certainly are here for such a great cause, and we're so proud of all the work that you guys are doing as well.
Thank you so much.